Welcome back. Our next guest, Abhay Soi, CMT at Max Healthcare. We've got lots to discuss with him in terms of growth strategy, the strong return ratios that the companies continue to see, and really what's driving that performance in this competitive market. Abhay, thanks so much for joining us this morning. Let me actually just dive right in. When we're looking at the best ARPOBs and margins in the sector, what's really been driving that performance for you? What would you attribute it to?
So I think there are two different aspects which are driving, the ARPOB is essentially being driven by our locations. We are essentially metro-centric. 85% of our capacities are in the metros. So that causes a higher average revenue per occupied bed. But our margins are being driven largely by the structural cost savings that we did last year. So if it wasn't for COVID in the last 10 days, of FY20, we would have been touching about a 19% EBITDA margin. But then COVID happened, lockdown happened, and the first quarter itself was a washout. But happy to report we are back on track.
Absolutely. And investors have highlighted how superior return ratios have been demonstrated as the company's superior case mix has been driven by a strong focus on clinical excellence. If you could just elaborate on that for us, Abhay, exactly what that implies.
So we are primarily in quaternary care. We don't do primary and secondary care. We continue to be community hospitals, to act as community hospitals to our communities in the micro markets we are present in. But we also continue to do, our role as a quaternary care player is significant across the country. These are high-end super specialties that we operate in, such as oncology, solid organ transplants. We've recently been involved in the first COVID lung transplant, in fact, heart transplants, cadaver transplants, and so on and so forth. So this is all very high-end quaternary care, which also lends itself to international medical tourism. And again, this is largely driven by the fact that we are metro-centric, and a lot of the clinical excellence and clinical professionals, particularly as far as high-end specialties are concerned, do reside in cities because the social infrastructure is there. So our operations are given to high-end quaternary care, and that's a space we continue to play in.
Given that you operate in that hyper-competitive market of Delhi NCR, and we've seen the merger of two hospitals, what are the kind of synergy benefits that this is leading to?
Well, tremendous synergy benefits. I think at one end it is to do with on the purchase. We centralize the purchases. So when you're buying for a larger quantity or a larger number of hospitals, larger quantity of inputs, your costs essentially come down. On the branding part, again, on marketing, what we've been able to drive in terms of margins with insurance companies and so on and so forth, all of that gets a bit of a kicker. So we continue to enjoy those synergies with respect to the merger that we just recently undertaken. We call it a hyper-competitive market, places like Delhi and Mumbai and so on and so forth, because you predominantly have a large number of hospital beds over there. But we must also keep in mind that you have the largest section of affordable population, and the density of the population is quite significant. And a place like Delhi NCR doesn't only drain the three states of Delhi, UP, and Haryana, but as well as all of Northeast, North India, Central India, and so on and so forth. So it becomes a funnel. And like I said, it's more about the supply of the clinical talent as well, because that does happen to reside in Delhi NCR. You typically don't see this very high-end clinical talent for quaternary care in Tier 2, Tier 3 cities.
Sure. Abhay, investors also say that along with the case mix, which is an important retention factor, Max has a very low doctor attrition level. How is it that you're managing this in such a high competitive scenario?
Well, again, we have a dominant position in Delhi NCR. We are pretty much 2 to 2.5 times the size of the second largest player. We have 7 facilities in the Delhi NCR. So, we've got hospitals in Central Delhi, South Delhi, North, East, West Delhi, suburbs of Noida and Gurgaon as well. So what happens is, when you have such a large, just the feet on street, our marketing team and so on, the branding in that particular area is, so you get some advantages, synergies of being a significant and a dominant player in a particular region, because, you do end up becoming the first, port of call of the choice of place for most doctors to continue working in. So you'll see, as far as most departments are concerned, super specialties are concerned, we usually will typically have the highest revenue or the highest growth within the Delhi NCR for those particular verticals. So it automatically becomes the go-to place, and hey, I do believe it's the best place to work in. So we have a less rate of iteration.
Sure. Abhay, once COVID-related travel restrictions do loosen up, do you see a share of international patients actually go up, which can change then the overall mix?
So we already have 10 to 12% of our business used to be in pre-COVID times international medical tourists related, and 30 is back by about 30 to 40% now. About 60 to 65% of their business is yet to come back, and certainly I think once the travel-related restrictions go away, this business will most certainly come back. But I think most importantly, this pie itself will increase because a lot of the Middle Eastern countries and so on and so forth, who were big purchasers of medical tourism, they sponsor medical tourists to various parts of the world. Will now be seeking value because there are pressures on their balance sheets, on the treasuries. So which better place for medical tourism in terms of value and affordability compared to India. So I really see this pie going up as we go along. But most certainly this business will return as soon as the travel-related restrictions are removed.
Abhay, morning. Nikunj Dalmia also joining in. Must compliment Max for the kind of COVID care they've done. I'm aware of the scare which Delhi and NCR region had in October and November, and the way your hospitals and the staff has worked, it's quite incredible. But taking the entire COVID reboot forward, Abhay, I was speaking to Dr. Raghuvanshi of Fortis, and his view was that, look, a lot of new verticals of businesses have gotten added, and one of them is telemedicine. Suddenly you can dial a doctor and you can consult a doctor. Things which probably existed on paper, but now a new norm. Are there new business lines which will now get added to your business only because of COVID and technology?
I think clearly what was, and this is across sectors, more so in the healthcare sector, what was at the peripheries is now being embraced to the core, which is really digital, both from a doctor's as well as patient standpoint. Digital and telehealth was always available. We have a proprietary platform which was involved in this business, but there were not too many takers, both from a patient and a doctor standpoint. But clearly, COVID, people were apprehensive or are apprehensive even now about coming back to hospitals entirely, particularly for OPDs. So that is something that teleconsults has helped us bridge. So it becomes the need of the hour. But I think now that people are getting used to it, we can also take it much further, both in terms of pre and post consults. International medical tourism will gain from it, and so on. I mean, essentially, look, you can cast the net much wider. You can reach many more people at very efficient costs. As far as OPD, and really take healthcare to many more people at a much cheaper cost, and that can also help as a funnel to your IPD services. So that works very well. I think other than that, you're also going to see healthcare delivery, healthcare at home. That's a business that we've been involved in for the last 5 or 6 years. That is something again which has got propelled due to COVID, because a lot of people are seeking healthcare at home. Typically, hospitals were providing IPD services, OPD services. But I think now we've started extending into digital health, reaching out to patients through the devices they have, as well as home care. That means really creating ICUs at home, doing physiotherapy at home. A lot of stuff that people came to hospitals for is now being conducted in people's homes. So that's another line. And as we evolve, I think all of us will see more and more verticals come through as well. So I completely agree with what Dr. Raghuvanshi was saying with respect to new business lines.
The challenge with the healthcare industry is that India needs healthcare, but healthcare and especially the hospital business is a capex heavy business. It's a business where you keep on expanding, and when you keep on expanding, your return ratios, they always tend to remain under pressure because that's the way the business is. How would you defend this? Because for investors, ultimately what they want is that they want businesses which generate a lot of cash flow and have superior return ratios. How would you address that?
That's right. So I think, if you draw a line on the business, and what we've seen is, at least with our present margins, we are already at very high teens, early 20s sort of ROCE numbers. We've deployed about 3,600 crores towards the healthcare business, and we are now, circa 19-20% EBITDA margins that we're operating in. And, we believe we keep going stronger from here. But having said that, you're right, it's a capex heavy business, not with respect to the assets that you are, mining at any given point in time, but the opportunity set is so large that you keep looking at various ways of seeking capital to be able to set up more hospitals. But I think what has also started happening is there's been a sort of a segregation of investors in the market. Now you've got growth capital and you've got yield related investors, through REITs and so on. So I think there is going to be a collaborative effort, and that's the way we are looking at it. Collaborate with various REITs and so on, where they can build out to our specs. They can have the yields, whilst our investors look at growth. It will just help us multiply, both our footprint as well as leverage the capital that we have much more efficiently than we have in the past.
And before we wrap, our last channel checks in November and December were indicating that the entire Delhi and the NCR region had a COVID crisis. But if I look at the recent numbers, now the COVID numbers are looking slightly settled. How are things what is the ground reality when it comes to COVID, and what currently is your preparedness in case there is a mutation?
So at present, what we've seen is the COVID capacity utilization has gone below 30% in our hospitals. And considering Max is the preferred place of choice, other hospitals, COVID occupancy is going down even further. What I believe is that, look, if we reach the previous peaks, of course, we will be prepared for that. And, if it goes a little higher, we could be able to accommodate that as well. But if, absolutely a different peak is formed, we'll have to find ways of addressing that situation at that point of time. But at this point in time, I can tell you there is tremendous availability. So if you see the Delhi app, you'll see overall less than 20% of the beds occupied, which are for, earmarked for COVID, are occupied for COVID. So there's plenty of capacity at this point in time. I think the huge challenge that Delhi is facing is on the non-COVID side now, because a large number of beds have been reserved for COVID. And I believe there is some amount of rethink in the government as well as far as that is concerned. And, we need to make them a little more fungible. The non-COVID business is back and roaring really. I think it's back to about 85 to 90% of its pre-COVID levels. And that's where we really believe there's going to be a shortage of beds going forward.
Okay. And finally, before we wrap, you have a dedicated COVID capacity. Your current COVID capacity, in your words, is less than 30%. But you will still have to maintain that COVID capacity till the time we are not very clear on the vaccine impact. So what happens to the interim COVID capacity where you've created a COVID capacity for regulatory factors and to ensure that the COVID care is taken care of? But if that COVID capacity is not utilized, it obviously means that a bed goes empty, a bed goes free. How will that change business for you?
Well, it's a dynamic situation. Like I said, we've worked with the government to bring down the earmarked beds. So at this point in time, I think over the next day or two, you'll see the number of beds which are earmarked for COVID come down. With the promise by the private sector players that this amount capacity will be brought back. If COVID rears its head again, or if there is huge amount of mutation, like it's been done in the past. So, over the next couple of days, you'll see this come down. But I think, so far, you have to play. There will always be a delay of a couple of days. I think it's a dynamic situation. We are collaborating with the government, and the government is collaborating with us to be able to, because I think the challenge is not only on the COVID side. Like I said, the challenge is also on the non-COVID side, and every life is precious. So essentially, the government also has to play the part of both COVID and non-COVID, address both the situations. So at this point in time, it's very clear that while COVID capacity has gone down and people's fear of COVID has also been reducing, people have started going back to hospital for a lot of the quaternary care diseases and what they were ignoring. Oncology, for example, what we're seeing, a lot of people who were pushed out their surgeries, had stage 2 cancer, stage 3 cancer, are now coming at a much later stage. So the fertility rate itself has become significantly higher. So I think, we have to play this balancing act. We have the scourge of COVID at one side, but we also have, a responsibility as far as non-COVID players are concerned.
Appreciate your time. On behalf of everyone from Team ET Now, first a big thank you for stepping up to the entire COVID care challenge, and let's hope 2021 is a better year and a great year for all of us.
Thank you so much.